Cancer can really affect your life in many ways, including the sometimes difficult challenges that come along with how you feel physically and emotionally.
When people are diagnosed with cancer, initially they're obviously upset, anxious, depressed, and supportive oncology has a wide range of options to help them deal with these emotions.
So the supportive oncology program at Rush has a variety of specialties that support our patients' overall emotional and physical health with the purpose of supporting their quality of life through cancer treatment and beyond, through cancer survivorship as well.
That I wanted to use every tool that was available to me through Rush, and so I've opted for as many as I could fit into my schedule, and have enjoyed them all.
So integrative medicine, otherwise known as integrative oncology, is a patient-centered, evidence-informed field of cancer care that utilizes non-pharmacological therapies such as acupuncture and massage and meditation and yoga as an adjunct to conventional cancer treatments like chemotherapy and radiation, as a way of helping patients optimize their health, boost their outcomes, and improve quality of life throughout the cancer journey.
We have all of these different disciplines under one umbrella in the same place. So it's like a one-stop shop for patients when they're needing support through their cancer care continuum.
I use acupuncture as an adjunct to conventional cancer treatments to help patients offset the sometimes many side effects that come along with chemotherapy or radiation. And so I'm treating patients for things like bone pain and nerve pain and muscle pain, sometimes nausea and vomiting, anxiety, stress, to help them feel better and improve their quality of life and overall well-being. The needles in acupuncture treatments are actually hair thin and very, very flexible. So beyond the patient experiencing a slight pinch, an acupuncture treatment is relatively pain-free. And to the surprise of most people, actually, many of my patients fall asleep during the treatment because they find it so incredibly relaxing.
My role as a clinical dietitian here with supportive oncology at Rush is essentially to help patients with nutrition needs along the cancer continuum, whether that's before, during, and even after treatment, whether that's answering nutrition questions, helping them with any nutrition concerns, any symptoms that are going on, and just help them meet their goals, whatever those may be.
As part of the cancer care journey, taking care of your physical health, of course, is one of the first things people think about. How are coping tools serving us during this time, making sure that we're able to manage mood issues like depression, periods of anxiety that may be getting in the way of our ability to connect with what matters to us in life.
I assist patients to address the barriers that they encounter while trying to access their oncology care. We help patients with things like transportation needs, housing, food insecurity, you name it. Whatever the patient presents with as an issue or a problem that's causing them maybe not able to complete their treatment.
Of course, a cancer diagnosis might bring up questions like, why is this happening to me? Or how do I make sense out of this experience? And my training allows me to be a compassionate listener, but I also have background in different religious beliefs and worldviews and traditions, and how all those things may inform how people make sense out of a certain experience. I accompany them as they struggle with those things and help them access the resources that they need to cope through all of the challenges that that experience brings on.
I'm very grateful that my disease held off for whatever reason until I was old enough that they had made these advances in care. The research has really shown that these supportive services, attitude and exercise and diet, have a positive researched effect on your system's immune system to aid the chemotherapy and the medical cures in helping a positive outcome and attaining a cure.
When there is a shift in pain for people, we often see a really positive result in how they're feeling in terms of their overall health and well-being, because they're able to sleep better, they're able to be more active, which all of that really makes a powerful difference in someone's life.
I'm very satisfied. I'm happy to be alive. Every day is a bonus day if I just recognize my mindfulness training and I keep my mind in the right spot. Be grateful for having the opportunity to talk to nice folks like you.